Not sure if medical checkup or beginning of a Family Guy, SpongeBob, Futurama, and a whole other cast of characters you may recognize. Get ready to laugh out loud because today we are back at it again, reacting to cartoon memes. Will they be medically accurate? Probably not. Will they make us laugh? You betcha. Let's dive right in. Doctor cuts umbilical cord. Jewish parents, you forgot the pickle. So then the pickle is his, you know what, the penis. Circumcisions reduce the risk of penile cancers, as well as just a cleanliness component of it. Doc, I have your diagnosis. Me? Be quick, Doc. I don't have all day. Doc, damn, who told you? Oh man, that's a messed up statement. Know how to say it appropriately. Be like, hey, we got some bad news. This is what's going on. This is what the likely prognosis is. A diagnosis is a term of what's going on. Diabetes, pancreatitis, myocardial infarction. When telling somebody they don't have all day, that's more of a prognosis. Clorox, ammonia, oh, that's a bad idea. Bleach and ammonia is toxic. It could be deadly. If you do drink bleach, come to the hospital. We need to make sure that you're okay. You make sure you don't aspirate it into your lungs. Do not do anything that is in this meme. Not sure if medical checkup or beginning of a If you ever see anybody, a doctor with a short coat, typically they are a medical student. When you finish medical school, you pass your boards, you get your medical degree, you get a long coat. And that's what you see more frequently in the hospitals. Eat the bat, expectation, it's morbid time. Reality, economic collapse. Oh my God. Are we gonna turn into a vampire?
Vampire.
When you inject vancomycin rapidly via IV without monitoring, yes, patient turns bright red. Oh my gosh. So that is actually called red man syndrome. It's caused by vancomycin. Vancomycin is an antibiotic that we use to treat normal infections. What happens is if you give the medicine too fast in the IV, this reaction can occur. It's kind of like an allergic reaction versus a transfusion reaction. So typically what you can do is actually slow it down and see if the symptoms improve. Patrick said, when your patient dies before paying. ER doctors have nothing to do with billing. We don't know how it all works. There's always a risk also of unpaid medical bills when somebody passes away. Now obviously it sucks, like why should you have to go through that situation? But think about it this way. Somebody comes in super sick, they get intubated, they get central lines, they get CPR done, they get all of this care done by a staff, and then a week later they pass away. So all that in the United States, that needs to be covered. We don't have nationalized healthcare. In other countries, there's nationalized healthcare, so it's already covered. Milk, calcium juice, bone sauce. I don't understand, but we think milk, that we need it to make strong bones. If you actually research more about milk and the calcium that you get might not be as good as we thought. A normal healthy diet has enough calcium in it. Foods that are rich in calcium, salmon, beans, leafy vegetables. You can hear the blood in your veins if you listen very You can hear the blood in your veins if you listen varicosely. Varicose veins are a type of veins where the vein valves have failed, but you cannot hear flowing through your veins unless you have an ultrasound with the acoustics on it, but it's a low pressure system, so you're very rarely going to hear a loud noise. It's going to be more of a swoosh. Brain aneurysm in a picture. Oh geez. Obviously this is like an old school picture. Which color dress do you see? Is it yellow, white, or black and blue? What color do you guys see? Let me know in the comments.
Definitely let me know.
So a brain aneurysm is basically like a weakening within the structure of the vessel itself, and it bubbles out. Versus this feels like it's trying to depict a AV fistula, where there's a connection between the artery and the vein. The doctor's face while reading your charts. It definitely is. When I look at the paperwork, most of the time now it's printed. You're kind of looking at it, judging it. But in medicine, there's kind of like a standard lingo and standard way you write something. So it's pretty easy to pick up a piece of medical documentation and be like, oh, okay, this is what's going on. When your doctor is talking to you, but you notice WebMD up on his computer. Kind of funny. I don't have a computer when I'm talking to patients, nor would I ever use WebMD. There's actually something called UpToDate, which is managed by physicians and has the most up-to-date information. There's other websites called EMedicine, which is quite accurate. You know what really grinds my gears? The fact that this type of surgery is still the most advanced method we have in increasing height after puberty, and it can cost upwards to over $60,000. You're breaking the bone, you're putting a metal rod, an intramedullary rod, and then slowly stretching it daily.
Let's go put him in the taffy puller. Taffy puller?
You can't just put things in and then reattach the skin. The skin has to stretch. If you stretch it too much, it can become ischemic and decrease oxygen to the tissue and it's gonna die. Maybe you can get something out of it and grow a little bit, but I, for one, would not suggest this procedure. Working with a difficult patient, how I look on the outside, what I feel like on the inside. Sometimes I find myself repeating 5, 10, 20 times, talking in circles. Sometimes patients don't feel well. They don't understand what you're saying. They don't speak your language. There are people that are intoxicated, on drugs, or just difficult patients that you just have to work with. Do your best to keep calm, keep cool, and stay professional. Disseminated intravascular coagulation. DIC. If I wasn't a medical professional, maybe somebody would call it something else. DIC is bad. Really messed up clotting cascade because you're really sick and all the factors are not working the way that they should, and you could be clotting and bleeding at the same time, so it's super scary. When your medic student sees the first shockable rhythm, oh my gosh, kaboom, question mark. Yes, Rico. Kaboom. I was a pre-med student in the ER. I had the pleasure of being able to shadow a really awesome doctor back in the day. And I picked up an abnormal rhythm called Wolff-Parkinson White. And I was so excited. Coronavirus quarantine day 23. Skin has fused to the couch. Oh my gosh. This is actually something that could happen. You integrate into the fibers because of tissue breakdown. We see this type of medical problem with people who don't get up and move a lot. My doctor. Unfortunately, I have determined that you are dead. My card declines. My doctor, oh, you're finally awake? So again, it's a billing thing. There has been an instance where people will die and then they'll come back to life. It's called Lazarus Syndrome, where they're literally dead.
You're dead! You are dead!
But for some reason, without medical treatment, start breathing again and they have a pulse again. I've had that happen once, but then the patient then permanently died just a minute or two later. All right, I love these medical memes. I think maybe I'm a little bit of a nerd at times and I just don't get them, which actually is funny. But I really enjoyed it. I hope you guys enjoyed it too. If you liked watching this video, please check out this playlist right here. And as always, do me a huge favor. Make sure you subscribe, turn those bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.